Hello, my name is Andrew Chantry, and today I'll be talking about aggression within mental health, creating a safer workplace for all nurses, clients, and visitors. Mary Townsend has stated that individuals who are aggressive defend their own basic rights by violating the basic rights of others. The brief introduction today will be looking at why aggression in mental health is a problem, what is being done to reduce aggression in the mental health setting, why reducing aggression is important to clients, staff, and visitors. How effective leadership may resolve, mitigate aggression in mental health. How I would care for an aggressive client as a new grad RN, and the legal and ethical boundaries relevant for caring for an aggressive client. Why aggression in mental health is a problem. As stated in the title, the problem faced is aggression. This can be both physical and verbal. Jim Keough states, psychiatric patients can become aggressive towards other patients and staff without any warning. A patient who is calm and controlled can suddenly turn threatening and violent. Aggression is a problem in mental health as it increases the chance of assaults happening to staff, co-clients, and visitors. Witnessing violent behavior can cause distress. Judith Schultz and Jeanette Davis state that nurses working with children and adults who have experienced or witnessed violence in their homes or community need to understand and recognize the mental, emotional distress that can result in these experiences. Becoming a risk to themselves, the client, through violence, can receive harm from other clients that may also hinder further relationships. Mary Townsend has stated that aggressive behavior hinders interpersonal behavior. A client is at risk of damaging their own reputation, also ending up requiring medication interventions, for example, benzodiazepine. They also might require physical, i.e. a hands-on approach by staff, mechanical, wrist or ankle restraints or belt restraints, etc., and chemical restraints, antipsychotics and sedations, etc. And they may require seclusion or confining a client in timeout. Ways of reducing aggression within the mental health setting. De-escalation. De-escalation will help minimize a person's anger and anxiety. Having a good rapport with the client may help with the de-escalation process. This is also known as, according to Jim Keough, talking down the patient. Stephen Kirby et al. States that demonstrating good knowledge and understanding of your client's problems can contribute significantly to the development of therapeutic relationships. New South Wales Health states that collaborating with each consumer or family member to identify particular stresses and or triggers, as well as their current drug and alcohol use, previous trauma, and history of aggression, is a good key to de-escalation. Medication. Often some medications, like benzodiazepines, may reduce the need to escalate intervention and reduce any current risks. New South Wales Health also states medications used as part of a treatment plan to manage a mental disorder or mental illness are not considered chemical restraints in New South Wales. Restraints. This may include chemical, mechanical, or physical restraints, and this action is usually taken when de-escalation or medications may not have worked, or a patient has escalated quickly before de-escalation and medications can be introduced. Norman Keltner and Debbie Steele have stated, nurses who are aware of the potential negative physical, psychological, and legal consequences associated with restraints and seclusions are apt to look for alternative strategies. New South Wales Health states special care must be taken in any hands-on or mechanical restraints to adapt this for the degree of frailty of the individual. Particularly, priority should be given for examination and review for potential acute physical health problems. Seclusions. If a client is required to be in seclusion, it will offer a low stimulus environment where a client's violent and aggressive behavior may reduce and them being able to rejoin the unit. Seclusions have been deemed as a last resort to reducing aggression in a client. Linda Damon et al. Has stated that seclusions is the involuntary confinement of a person alone in a room or an area where a person is physically prevented from leaving. Seclusion may only be used for the management of violent or self-destructive behavior. New South Wales have documented that New South Wales Health has taken significant actions to address restrictive practices, and the rate of seclusion in New South Wales acute mental health units has reduced by over 30% since 2010 to 2011. Why reducing aggression is important to clients, staff, and visitors. It is important to patient safety and health and a healthy workplace so that all patients can receive the best care possible. Visitors can be with their friends or family, and treating teams can deliver optimal care. Reducing aggression within the mental health setting will reduce the rates of injuries or harm being made or others being made to feel intimidated or belittled. With reducing aggression early can lead to an increase in developing good rapport and trust between nursing or treatment teams and the clients. Norman Keltner and Debbie Steele have stated that controlling aggression is a major component in maintaining individual and environmental safety. How effective leadership may mitigate aggression in mental health. Effective leadership may mitigate aggression within mental health by having a good communication skills and utilizing a good body language around clients to allow them to feel safe and help build up a good rapport. Understanding the client and willing to listen to what the client's needs and wants. By working well with a team, an effective leader can make him or herself available to support the treating team, be a voice for the client, and offer support in any client who will be showing signs of aggression. Ellen Jonasik and Jeanette Davies state that making an accurate assessment of a potential violent client can enable the nurse to diffuse the situation before the client becomes out of control. How I would care for an aggressive client in a mental health setting as a new grade RN. To increase my understanding of aggression in mental health, I would be willing to attend any and all in-services within the ward and hospital that will help develop my interpersonal skills and knowledge of mental illnesses. I would, as documented in New South Wales Health Policy and Procedures, undertake relevant training relating to the management of disturbed and/or aggressive behavior in restraint procedures. I would ensure that I am up to date with relevant policy and procedures within my local health district, state, and nationwide. Maintaining open communication with the treating team as to make sure that the correct care is given to the client. I'll always be seeking help when in doubt on a client's care, and seek help if I feel I can't help a client who is at risk of being aggressive. Following up with the appropriate written documentation with factual and precise information on what action I took when caring for an aggressive client. I would also frequently be talking to the clients under my care and wanting to gain their trust and build up a good rapport with them. I will seek debriefing sessions with colleagues after caring for somebody who has required intervention due to an aggressive episode. The legal and ethical boundaries relevant for caring for an aggressive client in a mental health setting. All staff must adhere to the principles of care outlined in the New South Wales Mental Health Act 2007, Section 68. The principles of the Mental Health Act regarding aggression with seclusion and restraints includes the needs to provide the best possible care in the least restrictive environment, provide high quality treatment and care in accordance with professional accepted standards, ensure that any restrictions to a consumer's liberty and interference with their rights, dignity, and self-respect is kept to a minimum. Ensure carers' rights and respected are respected and that they are informed about the changes in the consumer's care at the earliest opportunity. Physical, manual restraints by a team, mechanical restraint and seclusion should only be used for the people detained in a mental health facility under the New South Wales Mental Health Act 2007 or the Mental Health Forensic Provision Act 1990. One-on-one observations will be undertaken for the first 60 minutes, i.e. a nurse will remain in a visual contact of a consumer at all times during seclusion or at arm's length distance away from a consumer in a four-limb mechanical restraint. Ethically, a client suffering from aggression should only be restrained and placed in seclusion as a last option. If possible, a client should be offered time out in a safer environment, for example, the bedroom or a quiet room. A client should be offered a chance to talk their anger out, providing it doesn't end in themselves, another client, staff member, or visitor getting